start. First of all, thank you. Thank you for joining me. As many of you know, my name is Dr. Marc Kayem. I'm an ear, nose, and throat doctor and facial plastic surgeon practicing in Beverly Hills and Mammoth Lakes, California, as well as Las Vegas and the Cayman Islands. I'm sure you are overwhelmed with the coronavirus doomsday predictions that have been going on, and you've probably been stuck at home watching every show on Netflix and more, as schools and businesses have pretty much shut down or asked people to work from home. The idea here is to put things into perspective and for people to understand what is going on. There's a lot of misconceptions. There's a lot of wrong information that's being given out, and there's a lot of knee-jerk reactions happening that aren't necessarily necessary. And so the idea today is to speak about the coronavirus and really educate us to know what to expect, how to deal with this, minimize our risk, and really get through this together. So, interesting thing today, the Los Angeles County Department of Public Health, well, today being March 15th, 2020, stated that currently there are 69 cases of COVID-19 in Los Angeles County. Now, this is over 10 million people. This includes Long Beach and Pasadena. So we're talking about 69 cases currently out of 10 million people. And so it's important to understand that if you're in a shopping mall or at the grocery store, the person next to you very likely does not have it. Now, the situation is very fluid. Things are changing. This was the beginning of things in Italy, and we're all concerned, well, is this going to get a lot worse? But currently, the way things are now, the risk of contracting it in LA County is extremely low. And it does change from day to day. We have to stay on top of this, but the panic that seems to have taken a lot of people at the current time is misguided. We need to be aware of the issue, but at this point, it's not as if everybody around you has it, but you don't. It's very, very few people have it right now. Now, as a doctor, when we read a medical journal, say there's an interesting article we want to look up on some disease. If an article is a year old, we look at it and say, okay, this is cutting edge. This is new. This is up to date. Well, this is very different. With COVID-19, information from 2 or 3 days ago can be out of date as it seems to grow and change very quickly. So staying on top of it is just very, very important. And this is how we can all understand the issue better. The information that I'm sharing with you today is mostly from the CDC, the Los Angeles County Department of Public Health, and the World Health Organization. Some of the other news sites will have information that may or may not be accurate, but I'm basing mine on researched information from these recognized government agencies. So to start, let's discuss COVID-19. Where does the name come from? Well, the CO is for corona, the V is for virus, and the ID 19 is for the fact that it was identified in 2019. So it was identified, as most of you know, in China, and this occurred at the end of December 2019, so just a few months ago. And the reason why it's called coronavirus, the family, is that if you look at the virus under a two-dimensional electron microscope picture, there's a circle and there's these little outcroppings that look like a crown. And so the coronavirus gets its name from that appearance. And it's important to know that coronavirus is not new. SARS and some of the other epidemics we've had 10, 15 years ago were also coronavirus-related illnesses. It was just a different type of the coronavirus. Where does it come from? Well, we don't know for sure, but the pretty accepted theory right now that it probably came from initially bat stools from bat caves that are in China, and then probably got transmitted to another animal and from there to livestock, and that the initial infection in humans probably came from something as simple as people trying to clear the feces and aerosolizing the virus in the air and then breathing it in. So at this point, we're still learning a lot about it, but there's already some well-known information from the previous coronavirus infections from decades ago and how this can be transmitted. Now, how does it affect humans? And there's also the question, well, can domestic animals be an issue? The way it looks right now, domestic animals very likely do not transmit the disease and do not suffer from the disease. It really seems to be a human infection. And even though it was probably initially started through a vector from non-domestic animals, your cat and your dog very likely will not get the illness and will likely not transmit it. Now, the question is, how does it affect the lungs? First, we'll ask, are viruses alive? It's actually an interesting question. It's not a yes or no answer, because half the scientists say they're not alive and half the scientists say that they are alive. What does a virus look like? Picture a basketball filled with spaghetti on the inside and little outpouching spikes of protein on the outside. That's what it looks like microscopically. And that spaghetti is DNA, or something called RNA, which is very similar to DNA. And those little spikes contain these proteins that will fool your cell into thinking that it has something your body needs. And so your cell will recognize it as being not a threat. It will allow it to fuse with the cell, and then that spaghetti, or the DNA or RNA, gets thrown into your cells, and it hijacks your DNA to start making these proteins that your body doesn't need, but it's actually replicating the virus. So in the lungs, there's some cells that create something called surfactant, which helps the oxygen transfer in the lungs. Those cells get affected, a lot of other cells get affected, and usually the cell dies after releasing multiple virus particles. So that's the difficult, boring medical jargon part. Now we'll get into the interesting stuff, like incubation period and what we can expect. So incubation period is an important term. The definition is it's a time between when someone is exposed to the virus and when they first develop symptoms. According to the CDC, that's about 4 or 5 days right now. That's average. So from the time someone is first exposed to it until they get symptoms, during those first 5 days, they have the disease, but they don't have any symptoms. So it's still in the incubation phase. Now, 4 or 5 days is the average, but it's been described as short as 2 and as long as 14. So even though it's a range of a couple of weeks, for most people, within the first week, if you're exposed to it, you will start getting sick. It's important to understand that the virus is not airborne. And for example, tuberculosis was airborne. If it was in the air and someone was there hours ago, it could be floating around, you could inhale it and get sick from it. So the coronavirus doesn't do that. Now, it can be aerosolized, which means that if someone coughs it up in the air, it can be in the air for a short period, possibly even up to hours, and then slowly go away. So it's not something that you're going to catch by breathing air in, unless someone a few seconds before you sneezed in the air and you walked right in and inhaled that. So it's more of a contact transmission than it is an inhalation transmission. An important point also, and this one has a lot of different answers, how long can the virus live on a dry surface? Well, in a lab, if the virus is applied to, say, a stainless steel surface, it's felt that about 3 hours later, that virus will probably die. Now, if there's other factors involved, it could be much longer. One factor could be the humidity. If the air is very humid, then the virus is less likely to dry up. It could live longer. If someone sneezed or coughed and it's mixed with mucus, well, that's organic material that can allow the virus to survive longer. So it could be anywhere from 3 hours to even days, but in a lab, on stainless steel, it's felt that 3 hours is how long the virus can survive without having any or while still being infectious. So this is why the idea of social distancing is there. It's going to reduce the odds of exposure and spread. And so even if it is on something that you're close to, if multiple hours have passed by, you're less likely to catch it. And if you're not right next to someone who's coughing, then you're also less likely to catch it. We've seen a lot of local places, Disneyland closed, Mammoth mountain ski area closed recently, just to try to reduce the exposure that people might have by being very close to each other. But again, don't forget, 69 cases currently in LA County out of 10 million. Symptoms. What are the most common symptoms? The number one symptom that's seen most commonly once people are past the incubation period, once they actually start getting sick, is fever. And so about 88% of people who have symptoms will have fever. And the next most common symptom found in about 2/3 of people will be a dry cough, and followed by fatigue in a little bit more than 1/3 of people. And then having some colored sputum coming up on coughing, that'll be present in about 1/3 of people. Shortness of breath in about 20% or less, sore throat in about 15%, headache a little bit less than 15%, joint pains and muscle pains about 15%, chills about 11%, nausea or vomiting about 5%, nasal congestion or blockage about 5%, and diarrhea is about 4%. So this is based on experience from China and from some of the countries that have had infection, but the vast majority of people, the initial presenting symptom is going to be fever, shortness of breath, and feeling of coughing with mucus production. Now, if someone has the unlikely exposure and does get the disease, 80% of the time, it's going to be a mild disease. They're not going to need to go to the hospital. They'll be able to be treated by their primary care doctor. Obviously, if you have a cough or fever or you're feeling sick, even though at this point it's probably just the regular flu or a regular virus that's not corona, you don't want to take the chance and you want to isolate yourself. You don't want to go around near other people, especially elderly people who might have medical conditions who are at much higher risk of having problems. But 80% of people will have only mild disease and will not need hospitalization. Now, about 15% will have what we consider moderate to severe disease. So those patients are going to be sicker. They might need to be hospitalized. And for those patients, it's going to be a longer recuperation period. And they will probably need to be in the hospital. Now, 5% have severe disease. They might need to be in the intensive care unit. They might need to have a tube down their throat to help them breathe. And out of that 5%, well, around the entire 100%, that 5% is a subgroup of about 2 or 3% that will succumb to the disease. So the average mortality rate that's been seen with corona right now is about 2 or 3%. Now, does that mean that if you get corona, that you have a 2 or 3% chance of dying? No. If you're 20 years old and healthy, the chance of dying is going to be very likely less than 0.1%. On the other hand, if you're 90 years old and you're diabetic and you're on dialysis and you've got kidney failure and other medical conditions, the risk could be as high as 20, 25% or even higher. So the overall rate is 2 or 3%, but it has to be taken in context of your health. And as we get older, our health tends to fail, and so we're seeing a lot more of the advanced stages of the disease and the mortality rates much higher in the people who are older. The median time for recuperation in mild cases is about 2 weeks. And so that's from the onset of symptoms until clinical recovery. It's about 2 weeks for the mild cases, so 80% of people. And for people with either severe or critical disease, it's about 3 to 6 weeks for that 20% subgroup. But still, it's not something that's going to drag on for months and months. People usually get over it and very rarely will succumb to it. If someone has been diagnosed with coronavirus, COVID-19, they will be considered cleared of the illness once they have gone 14 days from the onset of symptoms or 3 days after the resolution of the fever and the other symptoms. So whichever one is longer. Either 2 weeks after you start having your symptoms or 3 days after you have no more symptoms. Whichever one is longer, that's when you're considered to now be cleared up of the disease. And as I'm mentioning, the information on here is very fluid. Yesterday, France came up with a specific event that they've noticed that usually young people are very unlikely to have the disease, much less than 1%. But they've had 4 young, healthy people that all had severe symptoms, and coincidentally, they all have been taking the non-steroidal anti-inflammatories like Aleve or Advil or Motrin. Now, at this point, it's too early to say if there's a direct link, but it's definitely suggestive enough that the current recommendation for most people is to avoid taking any such medication if you're sick with symptoms of a cold, if you can't be sure that you don't have the COVID-19 virus. So should we be worried? Well, worrying doesn't help, and it's leading to panic, and there's a lot of misunderstanding. This is not going to be like the movies World War Z or I Am Legend. It's a passing transient disease that has a risk of worsening but that hopefully that risk will not materialize. We tend to look at the worst case scenario, and I think that's what the news agencies are doing, and looking at the worst case scenario. Well, the worst case scenario is never good. I mean, if you look at yourself driving to work in the morning on a regular, beautiful, sunny day, what's the worst case scenario? You'll get killed in your car on the way to work. So we need to prepare for the worst case scenario, but we don't need to live life currently as if it is the worst case scenario. So definitely the idea of staying at home, of not going in public places, is going to be very helpful to prevent what we've seen happen in Europe and in China, where there was no limit to the disease because people didn't know and they were all in close quarters. But what's happening now with the social distancing that people are doing is the exact right thing we need to do. But we need to understand that right now there's still a very, very low risk for most people. And the more we understand this, the easier it is to deal with it and to understand that it's a passing phase that I believe probably over the next 1 or 2 months will have settled down significantly. And all of this uncertainty and concern and fear and misunderstanding will have passed, and we'll be able to get back to our regular life. So that's all I have to say. A copy of this webinar will be available if you want. You can just email me. It's Marc, M-A-R-C, at drkayem.com, Marc at drkayem.com. So have a good evening and stay safe. Good night.